Imagine this. You wake up to the news of a new deadly virus spreading fast. The shelves at the store are empty, schools are closing, and hospitals are overwhelmed. Your phone won't stop buzzing about breaking news all over town. You check on your loved ones, grandparents, siblings, friends with asthma or diabetes, and suddenly everything feels uncertain. People are scared and no one knows what's coming next. We've all lived through that moment. And while it feels like it's all the worst is behind us, the truth is we still aren't fully prepared for the next big health emergency, especially not in communities that have the fewest resources, the least access to care, or the hardest time getting trustworthy health information. But there is hope, and that starts with us. There's a nonprofit based in Atlanta that's helping to close those gaps. It's called the CDC Foundation. And today I want to show you how supporting them, even in a small way, can help protect lives, restore trust, and build a healthier future for everyone. Now, most people think the CDC, actual government agency, can accept donations, but it legally can't. It's called the in emergencies, that limitation can be very dangerous. That's why the CDC Foundation exists, to fill the funding and response gaps in the government that the government can't legally cover. And those gaps are real. According to Dennigan and McCulley, the United States still lacks a coordinated national strategy for pandemic testing. That means even today, we're not guaranteed or constant te- con- a timely or consistent testing response if a new outbreak begins. The kind of delay that can be very dangerous between a local outbreak or a national health crisis. And it's not just about testing. AGI found that many low-income individuals with own smartphones but don't use health apps, wearables, or remote monitoring tools. Why? Because of barriers like cost, lack of digital literacy, or unreliable Wi-Fi. And when digital healthcare leaves people behind, healthcare healthcare outcomes suffer. That's why many that's why this means when another emergency hits, either entire communities, elderly, rural, low income, disabled, risk falling through the cracks again. This is where the CDC Foundation makes a huge difference because it's not bound by government red tape. The foundation can act quickly, partner with grassroots organizations, and direct resources where they're needed most. During COVID-19, it launched over 400 emergency response projects and worked with more than 285 local groups, from small clinics to large nonprofits, to deliver vaccines, PPE, and public health messaging. And they didn't just stop at providing supplies. They listened, followed up, and adapted. Their programs were related. Their programs were rated by partners as equitable, sustainable, and community focused, something most traditional government response struggle to achieve. Another reason their approach works, they understand trust. Lee and Lee found that public cooperation during health emergencies is shaped by how well people trust the information they're given. Clear, consistent, human-centered messaging builds confidence, and that's one of the CDC's foundation's greatest strengths. It doesn't just share facts; it empowers people to act, protect themselves, and care for their communities. So I want you to picture this. It's not a global pandemic this time. That's a regional outbreak, or a hurricane, or even just a bad flu season. A grandmother in a rural town needs a mobile clinic to get vaccinated. A young mom needs help understanding how to monitor her baby's symptoms using a digital health tool. An overstretched hospital center needs backup funding to stay open just one more month. You Your donation could help all of that happen because the CDC Foundation has already built the blueprint. They've already they've already proven they can do it. They just need people like you and like me to believe it's worth doing. So here's what I'm asking. Go to www.cdcfoundation.org. Pick a cause that matches you. Maternal health, digital access, mental health, and make a donation. Even $5 goes a long way when it's part of something bigger. And if money is tight, that's completely fine. Share their mission. Spread the word. Your voice, your story could be what gets someone else to act. And if you don't need to be a doctor or a policymaker to make the difference in public health. You just need to care and make that first step. Let's not wait till the next emergency to wish we had done more. Let's do something now. Thank you.